All right, thank you, Chairwoman Eshoo. The COVID-19 pandemic has caused an unprecedented health and economic crisis. As mentioned, 200,000 Americans have lost their lives. More than 6 million have been infected with the disease. And of course, tens of millions have lost their jobs. And millions of American families are justifiably anxious and concerned about both their health and their financial security. So, as you know, the HEROES Act, which the House passed more than 4 months ago, would provide a lot of support and assistance to struggling families by expanding the healthcare safety net, increasing support to states to fund their Medicaid programs, and ensuring access to free treatment for COVID-19. But unfortunately, Senator McConnell and the Trump administration either do not understand the need for the federal government to take bold action, or worse, they prefer to willfully ignore and downplay the seriousness of the challenge before us. So let me be clear, further delay in passing the HEROES Act or coming up with some kind of a consensus bill will cost us countless lives, lasting damage to our economy, and immeasurable financial hardship to millions of American families. And unfortunately, the Trump administration is not interested in working with Congress to address this crisis. I know the president says he wants this or that, he wants a big bill, but hasn't really seriously sat down with the House leadership to come up with something that we can all agree on. Instead, the administration is actually seeking, in my opinion, to do further damage to our healthcare system and to the social safety net that millions of Americans have turned to during the crisis. And that's because the president continues to support this Republican lawsuit that is now before the Supreme Court to strike down the entire Affordable Care Act in the middle of this pandemic. And now the president and Senate Republicans are trying to jam a Supreme Court nominee through the Senate just a month before the presidential election. And I believe a big part of that is an attempt to seal the fate of the ACA and ensure its demise, because the hearing before the Supreme Court begins in November. Now, I want to remind folks that what is at stake here if the Trump administration succeeds and they do strike, and the Supreme Court does strike down the ACA. We'd have 20 million Americans who would lose their health care coverage. Protections for more than 133 million people with pre-existing conditions would be eliminated. And everyone who has been infected with COVID-19 now has a pre-existing condition, and in my opinion, could qualify as a pre-existing condition. Also, tax credits for affordable health coverage would be gone, and young adults would no longer be able to stay on their parents' insurance until they turn 26. And of course, there's a lot much more that would be repealed with the ACA, like the Indian Healthcare Improvement Act, and the list goes on. But it doesn't have to be this way. Instead of attacking the ACA, the Trump administration could use it to help people in time of crisis. According to a Census Bureau survey, over 3 million Americans have lost employer-sponsored coverage between April and July of this year. Yet the administration has refused to establish a broad special enrollment period to allow uninsured Americans to sign up for coverage through the ACA marketplaces. And the Trump administration also refuses to invest in outreach and enrollment efforts to make Americans aware of their coverage options, and instead has imposed arbitrary barriers seemingly intended to deter enrollment. In contrast, state-based marketplaces that have implemented broad emergency special enrollment periods have reported significant enrollment during the pandemic. People want to sign up. Now, the Trump administration also continues to undermine Medicaid, even though it has been a lifeline for millions during the pandemic. According to one estimate, since February, Medicaid enrollment has increased by 6 million people. It is never a good time to be without health insurance, and it's especially dangerous during a pandemic. A study by the University of Michigan found that even before the pandemic, Medicaid expansion has saved the lives of over 19,000 adults between the ages of 55 and 64. Medicaid is helping people keep health care coverage when they need it most. So today's hearing is an opportunity to better understand the ACA's impact on the status of health coverage amidst the COVID-19 and what needs to be done to expand and improve access to quality, affordable health care. And it's also an opportunity to reflect on what's at stake when the Supreme Court hears oral arguments in Texas versus California on November 11th. While the ACA has been a lifeline for millions during the pandemic, its future once again hangs in the balance with the Supreme Court. And I can't imagine, Madam Chair, that the stakes could be higher right now. So I look forward to the discussion. I think this hearing is very timely. And thank you again, Ms. Eshoo.